One really difficult part of my job as a forensic nurse is identifying people who I think may be victim of either sex or labor trafficking, and they are not ready for help yet.
Safety planning is key. Identifying where someone will go when they leave the healthcare facility, making sure that they have food and clothes for that night can be vital. And it also allows you to build that trust with that individual. When you take all of the aspects of their survivorship into account and you talk about safety and you let them know that you care about their safety, that will build trust and will perhaps allow them to open up, tell you a little bit more about what their needs are, and maybe have a more positive experience with healthcare in general. Hopefully that'll mean that they'll come back and continue to seek medical advice or resources from you. When it comes to minors, in 2016 we passed a law effectively making child sex trafficking a form of child abuse. Prior to 2016, trafficking of a minor was still illegal, but it didn't necessarily mandate a report to child welfare or law enforcement unless the perpetrator was a parent or guardian. After 2016, after we changed that law, now no matter who the perpetrator is, anyone who's a mandatory reporter of child abuse is also a mandatory reporter of child sex and child labor trafficking, because in 2019 we amended that law to also include child labor trafficking.
HIPPA was created to protect our patients' identifying health information, but it was never intended to be a barrier for mandatory reporting. So when we have a human trafficking patient present to us, if they're adult again, that doesn't meet less than 18, 70 and above, or at risk, it's okay to have that conversation with them about ongoing safety planning. But we have to understand that sometimes calling the police when they don't want us to is actually going to put that patient in danger. So we don't need to call the police. We can actually call the human trafficking hotlines without divulging any HIPAA by just being generic and saying, hey, I'm calling from University of Colorado Hospital. I have a patient that I suspect is a victim of trafficking. What are some resources in this area I can give them? And I have not disclosed any protected health information. I haven't given a name, a date of birth, anything like that, but I'm still able to give the patient some resources and maintain their trust.
The big thing is to let them know there are resources, give them numbers if that's possible, and let them know that you are always there. They can always come back here with the same complaints and we can pick this up right where we left off.
No healthcare provider is expected to be able to provide all of the needs of a trafficking survivor all on their own. It's vital that healthcare providers know the community resources that are available, know the statewide resources that are available, and one great way to do that is to tap into the Colorado Human Trafficking Hotline. So the Colorado Human Trafficking Hotline number is 866-455-5075. You can call that number 24/7 to access a trained professional.
Even if you think that you may have identified someone but you're not sure, if you call the hotline, they will help suss that out for you.